Now, keep in mind that in Colorado, we have one of the top diabetes centers, the Barbara Davis Center for Childhood Diabetes. And so I was fortunate that we had top level individuals who, first of all, already knew us because of our other kids. And they were there and literally they took our child out of my arms, started and got him hydrated at the appropriate level. And of course, in my brain, I'm going cerebral edema, cognitive
Yeah.
impairment,
Yeah.
etc. But it turned out extremely well, thanks to the fact that there were phenomenal people at the Barbara Davis Center in
So that
Children's
was a
Hospital.
children's hospital, a
Yeah,
children's ER.
yeah,
Could
Children's
you
Hospital.
imagine if you would have walked into a regular hospital where they have no pediatricians?
They would
Just
have started an IV. Yeah,
and
yeah,
called out.
and
They
flooded the
would say,
kid.
yeah, 2 years of age, you can't have diabetes. That's what they would say.
Yeah,
Yeah. And so when you started this journey, did you have Lente, long acting
yeah.
insulin, or was it all regular insulin?
No, we were giving Lente. Yeah, yeah.
Okay.
So
And then correct.
Lente in the day or in the morning with a little bit of a short
Call it
act
regular.
at that time. Yeah. And then we would use a short acting at the dinner time. And then I remember we used some milk with cornstarch and we didn't quite have protein supplements back then. We had it, but nobody really knew what it was. And so we used things like cornstarch to thicken their drink at night so they would not go low in the middle of the night.
And the concept of diabetes or autoimmune diabetes in particular has really changed since we went to medical school,
Yes.
right? First of all, we know it's not juvenile and such because a lot of early adults get type 1 diabetes.
Correct.
And second of all, and I've learned this from you, you can now diagnose diabetes very early on by drawing 4 auto tests that are available at LabCorp and Quest. And that informs you that the child is a diabetic, an autoimmune diabetic, before they require insulin.
Yeah.
You
And
have done a huge
Greenwood
study.
Greenwood
Then,
Pediatrics, Herb, we volunteered to be one of the first practices in the country to do what we call ASK or ASK study, autoimmune screening in kids. And eventually that study screened, I think it was 60 to 70,000 patients to look and see whether or not they had some of the antibodies that would predict the possible onset of type 1 diabetes. And so you've got kids who have one antibody, but once you get to 2 antibodies, you've got type 2, and that gets confusing for folks, but it's just the level that you're at. And you have an increased risk of developing diabetes. And they can even predict now the kids that are much more likely to get diabetes. So that means that for siblings of kids with type 1 diabetes, we can do these antibody screenings to look and see when they might show up with a second, third, fourth antibody.
so I'm going to come back to that in a minute, but I just want from the logistical point of view. You're a large practice, there's almost 30 clinicians. I don't know how many patient visits you did a year, but it's got to be over 100,000. And how did you the logistics? Did you test at 2, 6, and 9, everybody in your practice, or just everybody at once? How did you do that?
There was an age range as part of the study. And as I remember it, I believe it started at 1 year of age and then could go up into the teen years. And we literally had cards that we said, hey, if you're interested in being part of this study, we can move you over to this section of the building and they'll take a history and go through the process. And then they'll do a finger poke or draw some blood. And that's how we got the kids tested. And I was surprised how many people know someone with diabetes. And so they were interested in getting their kids checked. We all know this. Parents will do anything for their kids and to provide prevention, etc. So it warmed my heart to see how many people wanted to contribute to science, essentially.
How did you fund this?
It was a grant through Children's Diabetes Foundation.
Oh,
They came to me and said, "Hey, can we do this at Greenwood Pediatrics?" And then it expanded to the clinics at Children's Hospital, expanded to clinics throughout the country. And then there were several other studies in other countries where they also were tracking. And we developed this database of understanding and being able to predict what the outcomes could be. Now, we haven't talked about population health, but this is a great example of where we need to go for pediatrics in population health. Identifying specific populations, kids with type 1 diabetes, or kids with complex conditions, or kids with asthma, kids with depression, etc. And we need to pull that data together to find those trends, find those, I'm trying to think of the word, the things that cause delay in healthcare and that are roadblocks for kids to get the care that we need. And once we gather the population health data, that will allow us to solve some of these problems. And that's what the
So
payers.
did you find that this was overly burdensome for your practice? Was this difficult for your practice? Did it cost a lot of money for your practice to do all the screening?
No, now understand that my team of 3 or 4 individuals was much more passionate about it than other partners. That's not a criticism. That was just natural. And so I probably sent more people over there. And also keep in mind that I I probably had the largest number of families whose kids have type 1 diabetes. They heard that Fighton had kids with diabetes. And so I just ended up being the diabetes pediatrician in Metro Denver.
And then
So
another
I
another
had
question.
more kids with diabetes, so more siblings also.